If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411, you're in a good place. Today it's time to get an update from our Rockingham County Interim Public Health Director, Susan Young. Thank you so much, Susan, for being with us today.
Thank you, Mabel.
And we look forward to hearing what you have to say. Please give us an update on Rockingham County and coronavirus.
Well, Mabel, it's been a very active week. We currently have 886 cases, past and present. We do have, unfortunately, 12 confirmed deaths within the county. We have 17 people that are currently hospitalized with the coronavirus, and we have 425 that have recovered. That is a good statistic, and we do like to report good things too. There's a lot of people here in Rockingham County that have recovered. We do have 228 people that are still at home and are recovering in a phase where they're just staying at home and getting better, and they just get to stay at home and recover. We have 51 people that have been affected in an outbreak in our 2 long-term care facilities that we have here within the county, and we are working very closely with those long-term care facilities and the staff and patients there to ensure that everything that is needed for their care is being taken care of, and we are working very hard to make sure everyone is safe.
And we will certainly be thinking about them and hoping that they recover very, very soon. So with these numbers, what are your main concerns?
Right now, our main concerns are the long-term care facilities. And as you well know, we have worked extremely hard in Rockingham County to keep it out of our long-term care facilities. And I think we are this far in, we are over 6 months into this outbreak, and the county residents have done an excellent job to keep it out of the nursing homes this whole entire time. Unfortunately, it has, been brought in, and the only way it can get into a nursing home is by staff bringing it into the residents. So that has occurred, and it unfortunately spreads very rapidly within a nursing home because, of course, everyone is, confined to that space, and staff go from person to person doing care. So that's always a concern. And of course, the elderly with the age are hit the hardest. And most people that are in a long-term care facility have underlying conditions. So we're just trying to make sure that we are doing everything that we can. And the state has been notified, and we are working with our Department of Social Services partners, and we're working really hard to just ensure that the care is being given that is needed.
What else can we do as citizens?
Every citizen has a responsibility to do your part. Wear your mask, stay at home, wash your hands, wait 6 feet apart. But what we're seeing is more people are experiencing the COVID fatigue. They want to go out, they want to go to restaurants, they want to go to see their families, they want to go have parties, they want to have birthday parties for their children, they want life to go back to what it was before COVID. We are just not quite there yet, Mabel. We still need to practice the things that's going to keep everyone safe. And that, these people in the nursing home, they're there. They're doing everything they can do to stay safe, but it's the people out in the community that have to do their part to ensure that the whole community is safe. And I am very well understand that. I'm human. I have a family. I have grandchildren. And of course, we all want to be around our families as much as possible. The main thing I would say, if you are feeling unwell, you are feeling sick, you feel like you have a temperature, you just feel like you're just not quite yourself, please stay at home. Go get tested and make sure that you are not positive before you go out and visit anyone, go to any stores, go out in public. And if you do, please wear your mask to protect others.
Let's just do what we know will work.
Yes, and that's
because
what
all
we know
of the data
works.
shows
Yes.
if we would all put on our masks, what would happen?
If we could just get through 1 month and everybody wore their mask and stayed at home, and we could get through some incubation cycles, it would just knock this disease right down. So we just need to knock this virus out and get it under control and just protect our community.
And listen to people like you, because you all have spent a lifetime studying and training. You know what will help and what will work. All we have to do is listen. We listen to mechanics, we listen to IT people, we listen to our hairstylists. We need to listen to our scientists and our nurses and our doctors.
Right, and I'm going to call out a specific group because I'm going to tell you the average age of the people who have the COVID-19 right now are 18-year-olds and 21-year-olds. So that age range right there are the people who have the highest case counts at this time. So those are the people that are out and spreading it.
And you just think it'll never happen to me.
Right, and a lot of these kids may not know, these young people may not know that they even have it. They can be asymptomatic, have very mild symptoms. Yeah. But if you've been around anybody that has been sick or you know that's positive, please, please, please stay at home or stay away from these people and use your precautions.
Please offer for us a snapshot of what you're trying to convey with our daily COVID-19 infographics that are on our websites. We get so much feedback from citizens about the infographics, which I think are wonderful. Because if you can't read, you can just look at those little pictures and figure out exactly what's going on and put the numbers together. Tell us what you and your team are trying to do.
We are just trying to get that information out to the general public. We want you to know what is going on within the county. We want you to know kind of what's going on with the COVID virus and how it's spreading and what it looks like, how many people that are recovering, how many people are in the hospital. We want everyone to be aware. I will say a little disclaimer, and it is on our website. The information is updated as routinely as possible, and it is a snapshot in time. Things change. You may see somebody that's recovered that may end up in the hospital. I mean, that's we can't control that. So we do have circumstances where the numbers may look like something one day and then the next day be something completely different. But we're just trying to take a snapshot in time at that time of, to our best knowledge, this is what it looks like in Rockingham County.
And we want people to be interested in that infographic. Please keep going to our websites and looking at the infographic and checking information. We want you to do that. But understand the disclaimer that she just mentioned.
Right.
Yeah. Okay, so what message do you wish to communicate to illustrate how serious COVID-19 has been and how serious COVID-19 still is?
I think our recent uptick in deaths is all that needs to be said, because we had held our death rate from the very beginning at a very low rate. Here in the past week and a half, we have added to our deaths. I mean, we've had 3 people just in the past week and a half. That should be serious enough that, people would want to do what they need to do. That is somebody's grandparents, that is somebody's parents, that is somebody's relative, aunt, uncle, and these people are no longer with us because of the coronavirus.
We all need to just say we're going to do what we can to do what we know is best, and we certainly send our heartfelt prayers and thoughts to the families who have been affected. Tell us about the contact tracers.
We have hired some contact tracers on through the state to help us with our contact tracing for our cases. We can have one positive case and they could have 8 or 9 people that they have come into contact with that they consider close contacts. And I want to define what a close contact is. That is a greater than 15 minutes with somebody face to face. You can have a mask on, both of you can have a mask on, in an enclosed space. That really doesn't count being outdoors, but if you're in an enclosed space for greater than 15 minutes face to face with a person, then you're considered a close contact and are at risk for developing the coronavirus. So what is happening is we are trying to contact all those people and get them to stay at home for 14 days and get through that incubation cycle. If they develop symptoms, then they need to go be tested also and kind of have a ring around them also to protect those people that are around them. But the state contact tracers are helping us with this effort because we may get 20 cases a day, and if every one of those people have 8 other people we need to investigate, that's a lot of people to get in touch with and to contact trace. And please, 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 if we do contact you as a case, please be willing to give us those people. I mean, we're just contacting them to try to protect them and their families and their loved ones the best that we can. It's not punitive. It's not saying that they did anything wrong. It's just that we are trying to protect the community by getting those people isolated. And please just share their phone numbers and their contact information if you are contacted by the health department or a contact tracer from the state. Please share that information so we can get that taken care of.
Any additional words of wisdom from our expert?
I would just say that, please keep your eyes and ears on the media and the news. There is hopefully a vaccine on the horizon. There is, hopefully we can get people vaccinated in the near future, and hopefully by next summer that we can go back to living a semi-normal life. I mean, that is
go back to the beach.
Yes, we can all go back and feel safe being around each other and socializing. So just keep your eyes on the horizon, and that is positive and good news. We're hearing that from the state and our healthcare channels, so just stay tuned for more information about that. But I want my parting words to be, it's up to you guys, it's up to the community. I can only do what I can do as one human being and one person, but it's up to the community and each and every individual to make that decision to protect themselves, their families, and to protect others by wearing your mask, waiting 6 feet apart, and washing your hands, and just being as safe as you can.
Thanks again to Susan Young, our Rockingham County Interim Public Health Director. We appreciate all you and your team are doing. Thank you so much. We're in this together. Yes. We are family. It's a family affair. And you know what that means. We got to stay strong and help each other. Thank you so much for joining us. Rockingham County 411. You're in a good place.